sea lice control in Eastern Canada. I'm Larry Hammel. I'm professor in the Department of Health Management at the Atlantic Veterinary College, University of Prince Edward Island, Charlottetown, Canada. Atlantic salmon production on the east coast of Canada started in New Brunswick, but has since moved to Newfoundland and Labrador and Nova Scotia. Those are the provinces with suitable coastline. We produce just under 60,000 metric tons on the east coast of Canada, with about 50% of that production coming from New Brunswick and the remainder from Newfoundland and Nova Scotia. It's provincially based policies and regulations in the East Coast, and New Brunswick has had the longest history of sea lice concerns, starting in the mid-1990s with bath treatments. From 2000 to 2008, there was reliance on amamectin benzoate for control, and in 2009, resistance to amamectin emerged, and within a year, that resistance was quite widespread within New Brunswick, and that required emergency release of bath treatment options, deltamethrin, which is Alphamax, and azamethphos, which is salmon. In Newfoundland, sea lice issues were sporadic. They continued to be a concern, but sporadic. Amamectin benzoate resistance emerged later, likely after 2012. In Nova Scotia, there's only low levels of Caligus elongatus and virtually no Leptomonas, and so no treatments, bath treatments have had to occur in Nova Scotia. New Brunswick provincial government developed integrated pest management plans for sea lice and sea lice monitoring programs as a formalized documents in 2012 and recently updated. That was based on guidelines and other policies prior to that, but amalgamated several different plans into one. Newfoundland and Nova Scotia have developed similar policies, and so there is a standardized approach, but at the same time, very provincially based regulations. The reporting of sea lice counts is central to all of these regulations, and they report them to a centralized database required at least weekly for the weekly counts, and all the bath treatments and pre and post counts are submitted, as well as in-feed treatments, which are by vet prescription only, are also reported. The data for the three provinces is considered really separate due to the very different growing areas and conditions, and they don't influence each other so in many ways as distinct areas. New Brunswick has the most complete data set going back the longest time period because they had the initial resistance issue developed and the most sea lice, so we have the most information about sea lice for sea lice records, and so most of the rest of the remaining part of the presentation will focus on New Brunswick data. And according to industry in all these areas, the treatment experience has improved over time with additional treatment capacity increasing in the regions, delivery of treatment timing, and improved sea lice removal as time goes on. Over time for our sea lice mobiles, you can see that in 2010 when we had sea lice resistance to amamectin occur, that was the highest mobiles, and then we had a few years where the sea lice numbers were lower, and then since then we've had a few years where late summer and early fall we do have sea lice numbers expanding. For cage bath treatments, if we look at in any 1 week, the proportion of the cages that are being treated in that week, whether they're in which particular treatment regime they're in. At the beginning, in 2009 and 10, we had Alphamax, or the deltamethrin, being used when it was available. It's no longer available after 2010. Salmon is the pink color here, and so its use was in early times when we had the emergency release. And then in this time period, it looks blank because peroxide will be added. That's the green, so that's Paramove, and wellboats being introduced in 2010-11. And so then there was a mix as certain time periods, salmon can't be used or peroxide can't be used. So they mix those two in different ways. That's the other peroxide as in aquaperox. Then in 2017, warm water was introduced, warm water treatments, and also the mechanical treatments of hydrolysers And so the predominant treatments later on were mechanical in some way, or warm water. So we had chemical and peroxide being used over the initial part of the last decade, and then mechanical was introduced in 2017. And so if we look at the total number of treatments, we see Alphamax or the deltamethrin being used at the beginning, salmon throughout with a peak in 2016, and Paramove and Aquaperox, the two peroxide treatments, adding to those treatments, and then starting in 2017, warm water and the mechanical treatments, so that bath treatments in the last 18 months are 12% chemical and 88% mechanical or peroxide. For in-feed treatments over time, calicide was used early on, but not very frequent and not very often. Emamectin did come back, and the veterinarians use it in very selected sites when there is expected effectiveness. And so emamectin and ivermectin is used for initial post-smolt entry to delay sea lice starts. For cleaner fish, they are not included in our database here, so I'll just mention those separately. Lumpfish are our primary species, starting over the last 2 to 3 years, 3 years really. It's less centralized data on their use. There's more focus in Newfoundland, but the plans are to expand in Newfoundland and in New Brunswick. And according to the industry, the Newfoundland Cleaner Fish Program has been very successful, resulting in no treatments for sea lice in regions which previously had treatments. The main obstacles for optimal control that the industry is facing is limited access to controls applied to entire site or areas over a short period, as we had within feed. Cleaner fish can also be distributed over multiple cages and sites at the same time. Access to functional feeds and other treatments available elsewhere, but not in Canada, due to the timing for requirements of getting those approved. The late summer and fall increases put high pressure on the infrastructures that we have for treatments, and so that can be an obstacle as a lot of treatments are needed over a short period. Water temperatures during that time when we need the treatments the most are the highest and the hardest to handle fish during that time period. So the industry focuses its future needs on genetic selection for natural sea lice resistance, post-smolt prevention strategies by delaying smolt entry into sea cage so that they have less time exposed, developing vaccines, functional feeds for resistance enhancement, continued improvement of cleaner fish use, and mechanical prevention systems like shields and periscope nets that would help reduce the exposure, and ongoing monitoring for resistance and predicting resistance in the future. I would like to acknowledge the Atlantic Canada Fish Farmers Association, the Newfoundland Aquaculture Industry Alliance, Aquaculture Association of Nova Scotia, and the farmers for submitting counts and treatment data through the system.